A toothbrush is an instrument used for dental biofilm removal as an important part of oral disease prevention. Dental professionals recommend using soft nylon brushes and rounded bristles. This is ideal for proper oral hygiene. It is important to maintain proper grasp during brushing. You want to hold the brush firm but comfortable. This allows for control during movement, which allows effective positioning during strokes. You want to place your handle in the palm of your hand with the thumb on the shank, and you want to be sensitive to the amount of pressure that you apply. I'm going to display the Bass method of brushing. First, you want to position after grasping your toothbrush with the correct grasp. Position your toothbrush at a 45-degree angle, making sure that the bristles are on both the gums and the teeth. The motion that you want to use is a vibratory horizontal jiggle to make sure that you go into this sulcus. This allows for proper subgingival cleaning and also provides gingival stimulation. Concentrate on complete daily plaque removal rather than the number of times per day. You need to brush at least 2 times a day with interdental care. You want to make sure that you also are able to access the lingual portion of the teeth to make sure you get a complete and thorough cleaning, maintaining that 45-degree angle inside of the gingiva. Make sure to get your occlusal surfaces also. Be sure after 2 to 3 months that you replace your toothbrush so that you can avoid filament splaying or fray. Next, we'll move to interdental care. We have dental floss and dental tape. Floss tends to be thinner and rounder, and tape is wider and flat. I have tape here, as you can see. It's very thin, and this is good for patients with closed or tight contacts. Any kind of interdental tape or floss removes dental biofilm and reduces interproximal bleeding. When preparing to floss, you want to make sure that you have 12 to 15 inches in length of floss. You want to wrap the floss around your middle fingers of both hands, a little on one and the rest on the opposite. On the first, you're going to go 3 times around tighter than you are on the second. You're going to go loose on that. You want at least ½ inch of floss between the fingertips to be utilized. You want to guide the floss past the contact with a gentle sawing motion, being careful not to snap the floss through the contact, for you'll cause trauma and discomfort. You then want to wrap the floss in a C shape and pass the floss below the gingival margin, sliding the floss up and down over the tooth surface, and repeat until the surface is clean. You then want to wrap around and pull the floss so you get a new piece of floss so you don't transfer the bacteria, and you want to start in a new interproximal area, going in the same sawing motion, C shape, and up and down to clean the surface area. There are many methods of brushing, with the Bass method being the one recommended the most, for you get full thorough cleaning underneath the gingival sulcus. Furthermore, there are very many interdental aids that are also available based on need. I hope you enjoyed the demonstration of Bass brushing and C-shaped flossing. And remember, it's really important to brush twice a day for full plaque removal, and more than toothbrushing is needed for interdental biofilm removal. Choose carefully the aid and the method that you use. And happy brushing!